Okay, well, welcome everybody. This is Nurse Digest session number 4, answering common questions in digital health. My name is John Hardgrove, and I'm coming to you today with Maxwell Vloeberghs, who's a presenter from the Australian Digital Health Agency. And just wanted to say thank you for joining us today for this session, and we will kick it off now. I'd like to start by acknowledging the traditional custodians of the lands on which we meet and pay respects to elders past, present, and emerging. And yeah, so at this point, I'd like to hand over to Max. Max is going to run us through some of the commonly asked questions in digital health and run through some of the answers as well. And we'll be able to learn some of those answers and go from there. So Max, would you like to kick us off?
Yes, happy to. Can you hear me okay, John?
Yeah, I can. Yep.
Excellent. So one of the common questions that we get asked is, what's the difference between a shared health summary and an event summary? And when should a healthcare provider upload these documents? So as you can see on the screen, I have a shared health summary there. And a shared health summary, basically it's a summary of an individual's health information. And it covers 4 key areas. So those areas are your adverse reactions. So that includes your allergies and adverse reactions. Then you have your medications, your medical history. So within your medical history, you have your medical procedures as well, and your immunizations too. Then at the bottom of the document, and you'll see this at the bottom of a lot of documents within My Health Record, you'll be able to see the administrative details. So you can see who was the person who authored or created the document. So the shared health summary is uploaded by the patient's nominated healthcare provider. And this is a regular healthcare provider. So it could be a GP, it could be a registered nurse, or an Aboriginal and Torres Strait Islander health practitioner. With the uploading of shared health summaries, an enrolled nurse can't upload a shared health summary. However, an enrolled nurse can upload an event summary, which I'll be talking about next. So a lot of general practices that are connected to My Health Record across Australia are uploading the shared health summaries for their patients. And so you may be wondering, when is a good time to upload one? So shared health summary can be uploaded when you're completing a patient health assessment, so a GP management plan or a 75 plus assessment. And also if there's a change in any of these 4 key areas. So for example, if there's a new medication, a new diagnosis, you would be uploading a shared health summary. Even if there is a immunization, you could upload a new shared health summary. But one thing to be mindful of with this document is that if you add information in one of the areas, you need to add information in all of the areas because it's a summary. So if, for example, you uploaded a new medication onto a shared health summary and nothing else, then what that looks like to any healthcare providers who come across that shared health summary is it looks like the patient has no health history, no allergies, no other medication. So really, it's very important that whenever you upload a shared health summary, make sure that you tick the boxes to upload all of the information within the shared health summary. So it's an up-to-date one. Okay, so it's quite simple to upload a shared health summary as a registered nurse. So the health information comes from your local clinical information software, and then it gets auto-populated into the shared health summary. And then you just need to tick a few boxes to be able to upload it. Now, the event summary, what it does, this document captures key health information about a significant healthcare event that's relevant to the ongoing care of an individual. So an event summary may be used to indicate a clinical intervention, an improvement in a condition, or a treatment that's been started or completed. And in this example, we can see our patient has had an allergic reaction to cashews. So event summaries can be uploaded by GPs, registered nurses, enrolled nurses, and even allied health can upload an event summary when they're connected to My Health Record. So the event summary is also quite easy to upload. And creating one would be the final task after seeing the patient. So after you've entered in the progress notes and updated any medical history or changes to medication regimes, then in your local clinical information system, then you would be uploading the event summary just by ticking a few boxes. It's quite easy. If you want to learn how to do it, you can attend one of our training sessions. We're more than happy to take you through how to upload these documents and other give you some further information about using My Health Record. Otherwise, we also have resources available on our website, which I'll be providing you with details for at the end of the session today. So another question that we often get is, do you need to ask a patient and get their permission to go onto their My Health Record? So the answer is that a healthcare provider who has a legitimate reason can access the My Health Record for a patient that they're looking after. So the provider is really authorized to access it if they're providing healthcare to that patient. They're required to be permitted by their organization to be able to access My Health Record. And My Health Record must not be viewed for insurance or employment purposes. So My Health Record is used for providing healthcare to the patient. It's also best practice to discuss with a patient when you're viewing documents, especially if those documents contain sensitive information. In terms of uploading information to a person's My Health Record, so a provider that's providing care to the patient can upload to their My Health Record without speaking to the patient first. But again, we do encourage and it is best practice when you are uploading to someone's record that you let them know that you're uploading to their record, particularly if that is sensitive information. For example, like a registered nurse could be uploading a shared health summary to the My Health Record. They should let that patient know that they're uploading that shared health summary because they would need to verify with the patient that they are their regular provider for uploading the shared health summary. And so that would be just a matter of verifying that with the patient before it gets uploaded to My Health Record. Now, there are certain state and territory laws that require permission, that you need to get permission from a patient to upload sensitive health information. So that's sensitive health information. So if that applies to you, you would need to get permission first. But as I mentioned, it's always good to check with the patient when you're uploading to their record, especially if sensitive health information is involved. So another question that we often get is, where can I find immunization information in My Health Record? So given the current situation with the COVID-19 pandemic and the importance of vaccinations, it's quite relevant to know how to find the immunization information. So as a healthcare provider, you can find immunization information in My Health Record when you go to the patient's immunization consolidated view, which you can see on the screen here. So the immunization consolidated view displays details of the patient's immunization, even pulling through from the Australian Immunisation Register. So there is information coming from AIR as well as immunization information from shared health summaries and event summaries. So that also pulls through onto the immunization consolidated view. So I guess one advantage of accessing this through My Health Record is you don't actually have to go onto AIR to find the immunization information. You'll be able to find that information in My Health Record. So that's one of the advantages. If you're giving an immunization to a patient, for example, you can add a shared health summary as long as you add all the other details when you do add the shared health summary, as I mentioned, or you can even add an event summary and add the immunization as an event summary. and then you'll then be able to see that immunization information within the consolidated immunization view. So it's going to pull through from that shared health summary and the event summary. So as you can see here on our navigation panel, you can also click to go to the latest shared health summary from this view, and you can also click to go to the latest event summary as well. Another advantage of this view is that you can see the COVID-19 status for your patient. So you can see if it's up to date or not, when their next immunization is due, as well as that due date for the vaccination as well. So we also do get a decent amount of questions around pathology and diagnostic imaging reports in My Health Record. So you may be interested in knowing when you go into My Health Record, you'll be able to see your patient's pathology and diagnostic imaging reports. And we recommend using the pathology and diagnostic imaging reports overviews when you're looking at the reports, because they provide all those reports in a single view for you to be able to see. So as you can see on the screen here, we have the pathology reports overview. And this is the filter range that was put in to pull up these reports. So if you're looking for a report, for example, from 2016, you'd need to put that into the filter range first. And the reports are grouped according to the test name for the pathology reports, as well as the collection date. You'll notice on the left here, we have the organizations, and these are the organizations that are connected to My Health Record, and they're the ones that have uploaded these reports. And so you can actually click on these hyperlinks here if you want to go to the organization's details, and there should be a phone number there, so you'll be able to contact them if you need further details about the reports. If you want to actually view the report, so for example, if you had a patient who was diabetic, you wanted to check their latest HbA1c. So you could go here and click on this report hyperlink, and it'll take you through to that report. So having access to reports within My Health Record is so beneficial, because the tests will be available for viewing at the time of the consult, and it really saves the patient time that they won't have to repeat their tests again. Now, your patient may be wondering, they may be asking you why they had a test, they had a pathology test or a diagnostic imaging test, but that report isn't available in My Health Record. So it's important to know that there is a 7-day delay from when the report is uploaded into My Health Record till the patient can see the report on their own My Health Record. However, the healthcare provider is able to see the report as soon as it's uploaded. There is an exception to this, and that's for the COVID-19 results, which can be viewed both by the patient and healthcare provider as soon as it's uploaded. As a healthcare provider, when you're looking at a patient's pathology and diagnostic imaging reports, you'd be going to My Health Record, as I mentioned, just to make sure that your filters are set to the right dates to be able to find the reports that you're looking for. It's also important to be aware that there's a large number of pathology and diagnostic imaging providers that are connected and uploading to My Health Record. However, not all of them are. And we do have a list on our website that shows all the pathology and diagnostic imaging providers that are connected according to various states. So I do recommend that you have a look at that list as well. So if your practice is not sending patients to providers that are connected, I'd recommend giving your patient that option to attend a pathology provider or diagnostic imaging provider that is connected to My Health Record. So as I mentioned, there are a large number of pathology and diagnostic imaging providers that are connected. So the latest statistics from January tell us that there's over 180 million pathology reports in My Health Record. So they've been uploaded by those providers, and 19 million diagnostic imaging reports. So there's a lot of reports that are available for viewing in My Health Record. When it comes to diagnostic imaging reports, you'll be able to find reports in the diagnostic imaging overview. So as you can see on the screen, and this looks very similar to the pathology overview. In the diagnostic imaging overview, you'd be putting in the correct filter range. And then the reports are grouped according to modality and as well as examination date. On the left-hand side, you'll see that the organization that uploaded the report, and you can also click on that if you need to contact them to get further details. And if you click on these blue hyperlinks, you'll be able to view the report itself. So in the diagnostic imaging overview, you'll be able to find the reports. So certain types of reports you'll be able to find would be your ultrasounds, your CTs, MRIs, mammograms, X-rays. So for example, you'll be able to find the chest X-rays reports. You'll be able to find abdominal ultrasounds, brain and spine CTs, shoulder MRIs and mammograms. So you'll be able to see the reports from those providers that are connected to My Health Record. When it comes to breast screening reports, I've had some questions about this recently. Not all jurisdictions are connected and able to upload these. So or uploading them because they're not connected. So, so for example, Western Australia and Northern Territory are connected, but South Australia is currently in the process of getting connected. There are also plans to engage other jurisdictions as well. Also, I've had some questions around bowel cancer screening reports pulling through. So there is a certain pathology organization that does provide these bowel cancer screening reports. However, there's still work in place to get other organizations connected and uploading to My Health Record. So I hope that information helps with understanding a little bit more about the pathology and diagnostic imaging reports in My Health Record. And why you may or may not be able to see the reports. So the key message here is that if your patients would like to see their reports in My Health Record, they would need to go to a pathology or diagnostic imaging provider that is connected and uploading these reports to My Health Record. So if you want to see the list of all the different providers that are connected, you can just type into your web browser pathology and diagnostic imaging providers connected to My Health Record, and you'll see a list of the ones that are connected on our website. So I've got a link here, and I'll just show you what it looks like. So when you go onto our website, or if you just type into your browser, as I mentioned, pathology and diagnostic imaging providers uploading to My Health Record, you'll be able to you'll be pulled through to this page. So here you can see these are pathology providers and diagnostic imaging providers that will take any request form. So we have, and it's according to state. So for example, we have Labadee Pathology there, and there's multiple sites within Labadee Pathology. And then we have diagnostic imaging providers as well. So I highly recommend having a look over these providers and ensuring that if your patients do want their reports uploaded to My Health Record, they should be going to these providers. Now below that, we do have a list of other providers that are connected to My Health Record and uploading, and they can upload reports. However, they need to be set up with the practice, and they do have certain requirements. So these providers would need to be contacted first to be set up for e-requesting to have those reports pulling through to My Health Record. So I'll just go back to the PowerPoint. So we have many resources available to you that could be a good point of reference, especially if you have any questions around My Health Record or questions from your colleagues around My Health Record. You can always refer them to our website. We do have a lot of resources on our website. So we have, for example, e-learning modules. We have webinars that you can register for as well. We have clinical software simulators, so where you can go and in a simulated environment, have a look at how you would be uploading documents to My Health Record. So for example, I'll just show you what our modules look like. So here, if you go to training.digitalhealth.gov.au, you can see our online training modules. And as you can see, we have quite a list of them. So we have Introduction to My Health Record for Community Health in emergency departments, general practice. We also have Using My Health Record in nursing. So if you want to, we do have a lot of different modules with a good wealth of information in them. So you'll be able to access those through our website as well. So as I mentioned, we do have a lot of webinars, a lot of events coming up, and they're on all different subjects. We have case studies, we have virtual classroom sessions, practical demonstrations with various clinical information systems. So these are the various clinical information systems you can learn about, and you can register for these on our website as well. So for further information or support, you can always check the My Health Record website, or you can contact the My Health Record helpline on this 1-800 number. Otherwise, those resources I mentioned are on the digitalhealth.gov.au website. So that's always a good resource to check. You can email us if you have any questions. And if you want to follow us on LinkedIn, Facebook, or Twitter, you can keep up to date with the latest agency announcements. Now, I'll just show you what happens when you go onto our website. So when you go onto the digitalhealth.gov.au website, you'd want to click on Healthcare Provider to see the healthcare provider resources. So for example, you can see here there's different areas of practice, including nursing. If you want to look at nursing resources, then below that we have a lot of initiatives and programs that you may be interested in. And then we have our training and support section. So this is where you can go on to, if you want to do that software simulated training, so where you can practice uploading documents to My Health Record in a training environment. And this is where you go to do those courses that I showed you. So that's where you could go through the modules if you wish. And this tab here will take you to events and webinars. So here you'll be able to register for any event. So I strongly recommend having a look at these training and support, and even having a look at the events and webinars that are available, because we do have a lot of different webinars and sessions that you may be interested in. Well, thank you everyone for attending today, and I hope you all learned something and you enjoyed the presentation. So now I'll hand it back to you, John.
No worries. Thank you, Max. That was a lot of really helpful information. Now's would be the really good time to ask any questions if you've got them. We do have a Q&A box that you can feel free to type your questions into, and would be more than happy to answer any questions that you do have. In the meantime, while you're having a think about those questions, I'm just going to launch a quick poll. If you wouldn't mind just giving us your thoughts on today's session by answering the poll, that would be great. As I said, there is a Q&A box at the bottom of your screen that would be it's there if you need to ask any questions of us. We'd be more than happy to answer those for you now. Looks like we've got most of the people answering the poll, which is great. Thank you very much for that. And so we haven't got any questions coming through yet, so that's okay. If there aren't any questions, then we can probably take the opportunity to wrap the session up. Just wanted to say thanks again to Max for all of the helpful information that he shared. And to let you know that the next Nurse Digest session will actually be on the 12th of May. We take a brief hiatus during April. We know it's going to be quite a busy month with holidays and Easter and everything like that. So we'll be coming back to you in May on the 12th with some information on electronic prescriptions. So please feel welcome to join us for that next session. And thank you once again for joining today. If you've got any questions, you can feel free to follow up with the agency using that information that they've provided. And we hope you have a good afternoon. Thank you very much.